Today we're going to talk about pressure ulcer prevention. The goal of the presentation is for all undergraduate nursing students, will develop a knowledge base of understanding in the development and treatment prevention of pressure ulcers. Objectives is understanding what pressure ulcers are, understanding pressure ulcer development, prevention methods, management of pressure ulcers, educational and support of patients with pressure ulcers, and nurses' responsibility to the prevention and management of pressure ulcers. All right, 3 teaching strategies that's going to be used in this presentation are lecture, effective questioning, and of course through model. Before we start though, we got to make sure that we got an understanding of the different layers of the skin. So on this slide right here, we show the different layers to get an understanding: the epidermis, the dermis, subcutaneous, muscle, and bone. And this will help you understand as we talk about the different stages on the next slide. Now for pressure ulcers, your different stages, you got to first understand that, what a pressure ulcer is. A pressure ulcer is a localized injury to the skin or tissue resulting from prolonged pressure on the skin. You also got to understand that pressure ulcers have different names for them too. One example of that is that it's also known as a bed sore. Where do they develop? Mainly on bony prominences. And as you look here, I have ankles, heels, tailbone, and hips. That's some of the most common areas. But as you look at this diagram, that you'll see that they can develop on a head, the shoulder, on elbows, and of course we got the buttocks here. We focus on heels. You can even get these develop on toes. And as you look, ear, shoulder, and a lot of people don't look at the ear, but as we move forward through the presentation, patients that wear a lot of nasal cannulas can get pressure ulcers when develop there because they're never moved. They might be too tight. So as we look again at the next slide, that for pressure ulcers, that the stages are to help you understand, because it's not just the butt, it's also these areas on the skin behind the ear that you can develop. But as you look at stage 1, you can see it as an upside down part, or if you look at your skin, we're going to start from the outer part of your skin where the epidermis is. And here in stage 1, you can see where you start developing a little reddened area, or the patient starts to develop a little reddened area. And I have some clay models that I can actually show you that, where it looks like the skin, and you can see the red areas start to develop on that skin. Now, as a red area develops on the skin and breaks the skin, we start looking at it as a stage 2 pressure ulcer. And here you can see the stage 2 right there, where we broke into the epidermis area, but not quite yet made it to the subcutaneous soft tissue. And here in this clay model, I have an example here of the skin and how the reddened area has gotten deeper and how it started to break into the skin. Now, when we look at the stage 3 of a pressure ulcer, you can remember that we broke the dermis area as well, and now we into the soft tissue, or the subcutaneous soft tissue, and you can see how we broke in there. Now on a clay model, if you look at it, you can see here on the skin, here was the reddened area, and here where we broke into the soft tissue area and getting into that subcutaneous area. Now stage 4 is really critical, and that's where we break all the way through the subcutaneous tissue. And with that, you start getting into the bone. And I have a little clay model here that can show you how it has broken into the skin all the way through the subcutaneous tissue area, and then you can see this little white bone. But I also brought another little model to kind of show you on a human butt on what it actually looks like. And you can see here's where your epidermis and your dermis was broken, and then how we went into the subcutaneous tissue into the bone. As you can see, there's the bone area. And here you can also see, here's an example of a stage 3 where it's gotten into the subcutaneous soft tissue. And here's an example of a stage 2. And here's an example of a stage 1. But really focus on, how, if it's not properly treated and taken care of, or if you're not preventing pressure ulcers, how you can break into the bone area. And I showed the buttocks because that's one of the most common areas that is developed. All right, what are some causes of pressure ulcers? We look at 2 different causes. We have intrinsic factors and we have extrinsic factors. And as you look at intrinsic, is mainly dehydration, infection, decreased level of consciousness, malnutrition, medical conditions that limit the ability to change places, because a lot of patients, when they do get injured, they have limited mobility and they can't move themselves around in beds real well. Now, if you look at extrinsic factors, friction, moisture, incontinence, pressure, and shear, and as you look at friction, that can be just pulling a patient up into bed on the sheets. If you look at moisture, that can be all tied into incontinence. But, as we go to the next slide, and we look at, the most important thing is that we want to try to prevent these from happening, because you saw what happens when you get down to a stage 4. Now, one thing is proper grading of a pressure ulcer through assessment. It is so important that nurses learn how to properly assess a patient's skin and learn to go ahead and identify stage 1. Because once you identify that stage 1, that'll help you prevent stage 2 through 4 from happening. All right, another thing is pressure reducing mattresses, and you'll see an example in a second, but it's so important if you got a patient that's going to be lying in a bed for a long period of time. You want to make sure that you have a specialized mattress that can help reduce that pressure, because remember, pressure ulcers mainly develop when there's prolonged pressure on those bony prominences. Okay, positioning and repositioning, as you'll see as we look at a little bit further in the slides, that that is going to be a key thing, and we're focused on a time frame later, on the positioning and repositioning of a patient. Proper pressure ulcer management, we're focused on that as well. Nutritional planning is one of the most undermined, to me, important things that all nurses need to understand, because nutrition is critical in preventing pressure ulcers. Okay. Proper clothing, and that's really outside of a patient being in a hospital, that if they're at risk at home, you don't want clothing that's too tight on them. All right, proper hygiene, keeping the skin clean and dry, and that's what we saw earlier about incontinence. You don't want a patient to be incontinent. You want them to be dry. You don't want the moisture to accumulate, because that can be a common place for skin breakdown. All right, utilizing needed equipment properly. And as I mentioned earlier about nasal cannulas that provide oxygen through the nose, if they're too tight and they're not moved and skin's not taken care of, that can happen. But you also see them on masks, when patients wear CPAPs. All right, and here's an example of the mattress and a patient landed mattress. It's just making sure you have the proper layered mattress for patients that's going to be in a bed bound for a while. Okay. Next one is, how do we manage pressure ulcers? And I think that's really important that we understand that. Here are some key things. Proper skin care. You need to inspect the skin daily. In hospitals, we usually look at that on a 12-hour basis. Individualized bath schedules with warm water and mild soap. It's important that you keep the skin very clean. Avoiding massage over bony prominences. Lubricants for dry skin. So important. Appropriate support surfaces, as we talked about, mattresses. We was going to talk about repositioning every 2 hours. A patient must be turned every so often. Sometimes you might have to do it more than 2 hours. Offloading the heels off the bed. I showed you the slide earlier where you see where that's a common place for patients, especially in an intensive care unit that might be on ventilators, that develop possibility of a pressure ulcer in the heel. And managing incontinence. You want to keep the patient dry at all times. And here's an example of a nurse looking at the bottom of the heel. That is so important, because a lot of times, like I explained before, when a patient's on a ventilator, they bed bound, you want to keep those heels off the bed. Okay? Educational support to patients with pressure ulcers. Go ahead. And we want to look at, we want to encourage patients once we get them out of the hospital for proper teaching. You don't want them to smoke. You want them to have daily exercise. You want them to have good nutrition. That is so important. Can't emphasize nutrition more. Maintain a healthy weight. All that with nutrition is very important. Looking at adequate hygiene. Taking care of yourself. Moving and turning. You want to keep a patient moving. The more mobilization, the better it is for a patient. Another thing, okay, those are just some examples of educating patients. Okay. Nurses' responsibilities. This is one of the most important slides that we can talk about the whole thing, because it is important that a nurse understands their responsibility in preventing pressure ulcers and managing. Risk assessments of the skin by using a risk assessment tool. Braden scale is one of the most common tools that nurses use to ensure that we are assessing patients properly. Another example is proper skin care. Turning the patient every 2 hours while in bed. Very critical. And if the patient's not bedbound, you want to get them out of the bed. You want to get them mobilized and you want to get them moving. Another thing is turning the patient every 15, 30 minutes while in chair. That's what I was emphasizing. If you can get them out of the bed, get them in a chair. Even if they're in a chair, you want to get them moving at least every 15 to 30 minutes while they're in the chair. Very important for managing pressure ulcers. Another thing is head of the bed not greater than 30 degrees. Next is patient body at a 30-degree lateral incline position. Special cushioning devices. Pressure reducing mattresses. We showed an example of that, making sure that we have the right pressure ulcer mattress. Use of personal support devices. I know of a lot of heels. We keep patients' heels propped up, keep them off the bed. Okay? And of course, adequate nutrition. Again, is so important for a nurse to maintain focus on adequate nutrition, because that is really a key to a patient having their pressure ulcers or healed. And that's going to conclude a lot of this presentation about preventive ulcers and how to care for them and what you need to do for patients. But on the last slide, some of the references that I did use for that are going to be through Canon, also through DeMarco, and also through Worcester. And if there's any questions right now, I'll be more than glad to answer it and give a little bit more advice on how to prevent these. Thank you.